Hi, I'm Dr. Erin Madigan-Fleck, and welcome to DETV. Today we're going to be talking about microneedling. And microneedling is extremely popular today, but we need to know some specific things and guidelines about using microneedling. Microneedling right now is under some revamping as far as the FDA is concerned. So when you purchase a microneedle for use, please be sure to find out whether the needle has been approved by the FDA. There are some stringent guidelines that are being considered, and so estheticians need to be aware of these things in regard to using microneedling in your practice. So one of the things that's very important to consider when you do microneedling, number one, primarily I do microneedling and recommend it for home care as well. And when I finish my little presentation, I'm going to show you how I interface with Gabby and recommend microneedling for home. So the first thing you want to consider is the density of the skin. Why are you choosing to microneedle? What is the purpose? The penetration ability of the skin is very limited, and so microneedling will help facilitate penetration or activation of product. And when we're talking about home care, that's one of the most important reasons to recommend microneedling. The other thing that's important to consider is the size and the diameter of the needle. So right now, when you're looking at a 0.01, that diameter or under, basically anything under 0.2 millimeters is considered more cosmetic needling. When you go above that, it's considered into a different jurisdiction, and the FDA is considering that it is almost considered a medical device or device instrument. And this is where we have to be cognizant of selecting needles to roll and also looking at your state regulations with your state board. A lot of state boards don't have any guidelines yet, but obviously common sense comes to play. Now, we do hear the term CIT. CIT stands for collagen induction therapy. And in collagen induction therapy, we are not instigating that unless we go into medical needling, which means the needle actually has to pierce the skin. So this is a 3.0 medical needle, and you can see probably in comparison, there is some relief shadowing where you can see there's a big difference in the size of the needle. In medical needling, at a 3.0, the doctors are going to administer that with regional and topical anesthetic. So you can imagine the size piercing of the needle. What you're doing is instigating CIT by doing that because you're creating a puncture wound into the skin. Outside the medical setting, there are some very great concerns. Number one is secondary infection. Number two is trauma during the procedure itself, reaction to anesthetic. These are things that typically most estheticians are not trained unless they're working in a doctor's office, in which case if you're doing that type above a 0.2 or 3, you would be under supervision and under jurisdiction of the physician. So again, we need to pay attention to some of the up-and-coming pointers that the FDA is going to be considering. So one of the things we want to consider to have our clients do is to use microneedling at home. And with microneedling at home, it's going to help penetrate their product or facilitate the absorption of product. What we don't want to do is stimulate too much growth factors, and in particular one called VEGF. VEGF is the vascular endothelial growth factor, and that creates inflammation. So by regularly taking a large diameter needle or a large depth and continually doing microneedling on a regular basis when you don't have scarring, you're actually facilitating an expansion of VEGF growth factors, which could create redness on a permanent basis, capillary leakage, or capillary damage. So we want to be cautious about overstimulating the skin and doing too much microneedling. The other thing that's important is the product that you want to penetrate on the skin needs to be of a great integrity, meaning it needs to be at least a cosmeceutical, what we consider a cosmeceutical grade We don't want to put oils or heavy comedogenic product on. Growth factor serums, colostrum, anything that is helping to repair the acid mantle, helps with vascular conditions is what we need to do. In the case of Gabby here today, she's worried about a little bit of acne scarring. And she doesn't have a lot, but I want to help facilitate that repair process rather than her going for laser. Now, her dermatologist has recommended laser to her, and she and I have discussed she doesn't want to go that route, so we're going to try microneedling. So Gabby, what I'm going to do today, we've looked at your chart. Everything looks good from your last enzyme session. We've had some good clearing. Your skin's calmed down a little bit, so I think there's no active acne we need to worry about, so I think we're good for the microneedling. This is just a demo. I just want to show you how it looks. And, you know, when I say needling, I know your eyes went, oh my goodness. It doesn't hurt unless we do it improperly. Okay, so I want you to go ahead and just touch it. This is just a demo, all right? Now look at the difference between that one. Go ahead and put your finger on that. See, that really, it's too aggressive, too much. So what you're going to do with this at night, I'd like you to do it at night. You're going to use your needling with the special serum that I've given you. That's going to be in your Holistoderm kit, and that's the night serum, the night repair serum with the growth factors in it. So you're going to use your needle on clean skin, dry skin, and what I'd like you to do, I'm just going to demonstrate on my hand, and I don't use this on anyone. This is just to show you. But you're going to put a fairly firm pressure, but not tremendous pressure. You're going to go back and forth, vertical, horizontal, and then diagonal. Okay, so you go ahead and try it on your hand. Well, you can feel if you put too much pressure, you'll know it ouches a little bit, right?
Yeah.
Okay, so we're going to start, I'd like you to start probably 2 times a week to start out, and then we'll see how you do, and we'll graduate up. Some areas of concern: number 1, don't push too much on the forehead because there's not a lot of fat pad up there. So the nerves, you're going to hurt a little bit more. Same thing around the temples, and I don't want you doing your neck for now. Okay, we're just going to do the scar area. So your particular product, this is factory sealed. This is another thing that's important. I like to show my clients that this has an expiration date to make sure the sterilization of the needle is there, right? This has not been touched from the factory, and it's in a Ziploc sealant. It's also sealed inside a plastic container. It comes inside the plastic container because you're going to need to clean it as well, okay? So this is a special cleaning solution. And there's a little tray in there, and you're going to dump some of the liquid in the tray. And every time you use it, I'd like you to clean it. So you'll just take it across that pad, run it back and forth, rinse it after you're finished, and then just put it in a cup and let it dry. Okay. Please don't use alcohol on it. Don't use hydrogen peroxide. Don't try to clean it with tea tree, because that plastic can be corrosive. In other words, we don't know what your cleaning product may do, and we don't want to corrode the plastic or dull the needles. They are expensive, and I want to make sure you have it for a long time, okay? So again, you're going to clean your skin, the double cleansing process, dry it really well, take your microneedle, do it dry, maybe 4 passes, that's it, lightly, and then put your serum on, and then when you're finished, you're going to go ahead and clean, okay? Any questions?
No.
Okay, great. All right, so we'll get you ready to go, and we'll check you out. And thanks for your patronage today. We look forward to seeing you in your next appointment.
Thanks for watching Derma Education TV. Join the DETV Preferred Professional Network to browse available classes and get 10% off during summer 2018. DermaEducationTV.com.